So, what we need to do is just go through all the medications, and we'll go through it quickly, and you'll see why this is important. So these are the 4 randomized controlled trials looking at Remdesivir for in-hospital mortality. And you can see that Remdesivir does not significantly reduce mortality. And this becomes important, as we'll see later on. The next is hydroxy. That's a really bad spelling mistake. Hydroxychloroquine in hospital RCTs. So you can see actually there's a trend towards harm. So hydroxychloroquine should not be used for hospitalized patients. You can see a very strong trend towards harm with hydroxychloroquine. And this is reproducible amongst the studies. It's really important to note for the viewers, this is a meta-analysis, and when you look at a study like this, you want to see if the studies line up. And you can see in this graph, this forest plot, all the studies line up on the right of unity, which means they're all showing the same effect and that the drug is harmful. So this is hydroxychloroquine in outpatients. So this is what you were talking about. So actually you can see what happens is the effect now switches to the other side. So all 3 studies tend to show a benefit, but this is not statistically significant. So there's a trend. So if you notice that in hospitalized patients, hydroxychloroquine is harmful. In the outpatient setting, these are randomized controlled trials, there is a trend towards benefit. So I think that's important, but as you'll see, there is a much more effective drug to use than hydroxychloroquine. So the trend is towards benefit. These are studies now in terms of prophylaxis. The one study by Mitchell was actually published in the New England Journal of Medicine today. So in terms of prophylaxis, you have post-exposure prophylaxis. So this means that you've been in contact with someone who has COVID, say someone in your family. That's called post-exposure. Pre-exposure means someone, if you're a healthcare worker and you haven't been exposed yet, but you're potentially at risk. And you can see that both for post-exposure and pre-exposure, there is a trend towards benefit with hydroxychloroquine, but again, it doesn't reach statistical significance. That also becomes important because I'll show you a drug which is effective. So this is an interesting meta-analysis which was recently published, looking at observational versus randomized studies. So what's interesting is that the non-randomized studies align to the left of unity, whereas if you go down a little bit, Dr. Bean, the randomized studies actually are on the right of unity. And that shouldn't happen. They should align perfectly together. So when that happens, you suspect that there must be some kind of selection bias in the observational studies. So as we said before, the studies should all line up. But in the hydroxychloroquine studies, the observational studies and the randomized studies show differing effects. And I think it's because there's profound selection bias or other bias in observational studies. Okay, we now move to ivermectin. And I think this is so important. This is where the money is. So as you can see, there are now 4 randomized controlled trials and 3 observational trials looking at ivermectin in hospital mortality. Now, if you notice, all the squares are on the same side of the unity. They all line up perfectly. And the overall effect is so statistically significant that it's P equals 0.00000. It does not become any more statistically significant than that. My friends, this is an absolutely essential slide that we need to spread across the entire world because there are people who do not think that ivermectin works. We have now 4 randomized controlled trials, 3 observational trials, all showing exactly the same thing. Ivermectin saves lives. What more data do you need? Maybe we need to say that again. Ivermectin saves lives. It is a safe drug. 3.7 billion people have been treated with ivermectin. It has a profound safety profile and saves lives. And if you compare the ivermectin data to the hydroxychloroquine data, the data speaks for itself. Next slide. So again, what this is showing is the studies all line up. The observational studies and the randomized studies line up on the same side of unity, which is really important for the external validity of these studies. It means that the effect is absolutely reproducible across different studies. So this is a real effect. And I think that the healthcare authorities, the NIH, the CDC, the WHO, need to wake up, because we now have convincing data that ivermectin can save lives. Next slide. So this is ivermectin prophylaxis. Now this is even more dramatic. So as you can see, there's post-exposure and pre-exposure prophylaxis with ivermectin. Can you see how statistically significant it is? Again, the p-value is 0.000. So while hydroxychloroquine, it was trending towards significance, with ivermectin, it's highly statistically significant. So again, ivermectin is a life-saving intervention to prevent COVID and to treat COVID. I think the data is now irrefutable. So the next is a summary slide for people who kind of don't get it. So this is a slide of failed therapies and successful therapies in different phases of the disease. So we talk about pre-post exposure, the symptomatic phase, and the pulmonary phase. So if we look at hydroxychloroquine in the hospitalized patients, this tends to harm. In the pre-post exposure incubation period, it's unclear. It may have a small benefit. Remdesivir does not work. Kaletra does not work. Inhaled interferon may work in the early stages. Tocilizumab, which is the interleukin-6 antibody, doesn't work. Convalescent serum does not work, and we have a randomized controlled trial, again today published in the New England Journal, which shows that convalescent serum does not work. Okay, so unfortunately, all these people who have kindly donated their serum, it was a futile exercise. Convalescent serum doesn't work, and we could have predicted this based on the pathophysiology and how the antibodies work. It's not a big surprise. Corticosteroids, we know they're life-saving in patients who need oxygen, but what we want to do is prevent people getting to the hospital and requiring oxygen. Very important to stress, because there are some cuckoo heads out there who are giving corticosteroids to people early. Corticosteroids decrease your immune response and allow for increased viral replication. There's no place for corticosteroids early in the disease. As we see, ivermectin is a remarkable drug because it is highly statistically effective in the early phase, the pre-incubation, post-incubation, the symptomatic phase, and the pulmonary phase. So across all tiers, ivermectin is now proven. This is not of theoretical construct, has been proven beneficial in all these stages of the disease. And what is so remarkable is this is a very cheap drug. It's very easy to administer.